This segment of DelmarvaLife is brought to you by Delmarva Acupuncture and Wellness Center.
There is so much to enjoy about summer here on Delmarva: the ocean, the events, the quality family time. With that, though, come the struggles of this season, one being ticks and the spreading of Lyme disease, and that can really wreak havoc on the body.
Now, fortunately, our friends at Delmarva Acupuncture and Wellness Center can be a huge part of the fight back. DelmarvaLife's Katie Zerilli talks with Dr. Ashley Adams about why acupuncture is big-time beneficial when it comes to healing from Lyme disease.
Dr. Ashley Adams has one overarching objective when it comes to all of the patients who walk into Delmarva Acupuncture and Wellness Center: to help them feel better.
And that's ultimately our goal here.
The pain that puts them here, of course, varies. Pain that comes from Lyme disease is profound and powerful.
It affects the entire body. So you got severe joint pain, you have brain fog, you have gut issues. I mean, it runs the gamut in the body.
Fortunately, along with an antibiotic, acupuncture can be an invaluable force in fighting back.
So we help with the widespread body pain. We help with the gut issues and the brain fog. We add many modalities within my practice to get to the underlying of the spirochete. And so the spirochete tries to bury themselves in the body, and we want to try to get them up and out of the body.
Because when in the body, this thing wreaks real havoc. At times, it's simply unbearable.
When somebody has Lyme disease, it affects your body so much that sometimes you're not even sure if you want to be around anymore. Like, the pain is that severe. The just every day in and out, I'm exhausted, is so real in someone's life. So they have other comorbid things because they're just so down on themselves. They're down on their own body.
Dr. Adams has relieved quite a few patients of pain. She says treatment here at Delmarva Acupuncture and Wellness Center also includes IV therapy.
We have to look at all their lab results, but most of the time we're going to do the inflammation buster because they have so much inflammation in the body that we want to try to get that down. And combining that with some taurine, which helps with the brain fog, and it's a neuroprotectant. Those are things that we want to work with.
What exactly the treatment looks like will vary depending on how long a person has had Lyme disease.
Normally people will see me 2 to 3 times a week in the beginning, and then we taper off from there depending on how their symptoms are.
What'll also vary is the time it takes to feel better.
So it really depends on how long have they had it. Do they have anything underlying with the Lyme disease? You know, is there any comorbidities with that?
Because they're one piece of the puzzle, they make sure they're communicating with the other parts.
We do talk to primary care, and we actually brought primary care into our building now because so many people are in need of primary care that we've added that onto us as well.
One of her patients had to get rides to and from her office because of what the disease was doing to his body. That's not the case anymore.
And so to see him be able to drive on his own, or to make decisions on his own, to have a job where he's helping other people, he's actually helping other people in his job now. And that's amazing for me. You know, it's kind of like that ripple effect. You know, you help one person and then you're helping so many more people by helping that one person.
And she's helped far more than one person, and will continue to, with the astounding resource that is acupuncture.
Now, Dr. Adams does say that she has some people who are hesitant because of a fear of needles, but she wants to remind you these needles are extremely small. As a matter of fact, 33 of them could fit into the head of a typical needle that you would think of.
Yeah. She showed me.
Yeah?
She put them in my forehead, and it does not hurt at all.
Didn't feel it?
Nope.
How about that?
Nope.